The liver has been extracted from the body cadaver, and we can see the liver here. To hold it in anatomical position, we have to have, this is the right lobe of the liver, which is the larger one, the smaller left lobe of the liver, and this is the groove for the inferior vena cava. Now the inferior vena cava, it lies exactly vertical in this fashion. So this is how you can, which helps to determine the anatomical position. If you see, this is the falciform ligament. This is the falciform ligament that divides its attachment divides the liver into the right and left anatomical lobes. Okay, this falciform ligament is bilaminar, and its layers divide to the right as the superior coronary ligament and to the left as the left triangular ligament. So this is the left triangular ligament. Then this is the superior coronary ligament. It reflects to the diaphragm as the right triangular ligament, and then again reflects back here as the inferior coronary ligament, and encloses the bare area of the liver. You can see the lack of shininess due to it being non-peritoneal compared to the rest of the surfaces. Then the peritoneum is reflected on, it is covering the inferior vena cava, so the floor of the inferior vena cava remains non-peritoneal. Then it is reflected on the caudate lobe. This is the caudate lobe, okay, reflected on the caudate lobe and on the walls of the fissure for ligamentum venosum, then on the left lobe. Again, the peritoneum, it reflects along the walls of the fissure for ligamentum teres hepatis, and then covers the quadrate lobe. This is the quadrate lobe. Then covers the gallbladder. So the fossa for the gallbladder remains non-peritoneal, and then covers rest of the inferior surface of the right lobe of the liver. And this is another specimen or viscera. This is, we can say, superior coronary ligament. This is ending as the right coronary ligament. Sorry, the right triangular ligament. So what are the bare areas here? Oh, one more point is that the lesser omentum, it comes in relation with the caudate lobe and around the boundary of the porta hepatis. Remember, this was forming the free margin of the lesser omentum was forming a boundary or anterior boundary of the epiploic foramen. Now what are the ligaments attached here? We have talked. Now in the fissure for ligamentum venosum, there is the ligament, lies the ligamentum venosum, which was the patent ductus venosus, and here you can see the ligamentum teres hepatis. Now what are the bare areas? 8 of them are there. If you see, this is the bare area which is bounded above and below by the superior and inferior coronary ligaments. The apex is formed by the right triangular ligament, and the base of the triangle is formed by the groove for the inferior vena cava. Then what we have, we can see the fossa for the inferior vena cava is also a bare area. The floor of the ligamentum venosum and the floor of the ligamentum teres hepatis are also non-peritoneal or bare areas. Then we have the porta hepatis, that is also a bare area. The fossa for the gallbladder is another bare area, and attachment along the of the falciform ligament is also a bare area, and this cardiac impression, this is also a region of bare area. Now the impressions or visceral, see, we have an anterior surface and a visceral surface. The visceral surface is the posterior surface and the inferior surface, and also there is a right lateral surface, and there is one sharp inferior border. We can see here one sharp inferior border. The inferior border has a cystic notch through which the head of the gallbladder is peeping downwards. You can see it here. Then what we have, what are all the visceral relations on the superior surface? Here we have the cardiac impression. This is the cardiac impression. Then if we see the visceral surface below, what we have is, this is the first impression, this is the esophageal impression. Then this forms the gastric impression. Here we see a slight elevation. This is related to the tuber omentally of the pancreas. And as we go down here, this is the quadrate lobe. The quadrate lobe is related to the pylorus, and here we have the duodenal impression. Then we have the right hepatic, the hepatic flexure or the right colic flexure impression or colic impression. Then we have this as the right kidney impression, and towards the posterior surface above is the right suprarenal gland impression. So this is the caudate lobe. The caudate lobe has a process running towards the right lobe. This is the caudate process, and one running downwards towards the quadrate lobe is the papillary process, and this quadrangular process, quadrangular lobe is the quadrate lobe. Now this is the porta hepatis. The porta hepatis, the three structures very well visible here are the portal vein with the largest lumen and thinnest wall. The thickest wall is of the hepatic artery, and here we can see a greenish structure with irregular wall and smaller lumen than the portal vein. This is the bile duct or the common hepatic ducts. The two hepatic ducts join and form the hepatic duct that will later on go and join with the cystic duct and form the common bile duct. Now we are coming to the gallbladder. We see the upper end, actually the one peeping out from the lower border or inferior border of the liver. This is the head of the gallbladder, this is the body, and above we have the neck of the gallbladder. This is the fossa for the inferior vena cava, and what we see here, the openings, these are the openings of the hepatic veins that drain directly into the inferior vena cava. This is the main reason how this big viscera stays in its position in the abdomen.